Everyone, my name is Maisa Sami Ahmed Al Noor, medical student in Imperial University College, course Primary Health Care, Med 492, Group 2, Batch 18. Today I will present research on the role of primary health care, or PHC, in healthcare system strengthening with special focus on Sudan. Primary healthcare is widely recognized as the foundation of a strong, resilient health system. It is the first level of contact between individuals and the healthcare system, and it includes health promotion, disease prevention, diagnosis, treatment, rehabilitation, and follow-up care. The PHC is important because it brings healthcare closer to communities and makes care more accessible, equal, and cost-effective. The main idea of our research was to analyze how PHS contributes to strengthening health system gradually and how this applies to Sudan. We focus on the relationship between PHC and the 6th World Health Organization health system building, block services, serving service delivery, health workforce, health information system, access to essential medicine, financing, and leadership and governance. The main problem is that although PHC is the international recognized foundation for universal health coverage and better health outcomes in Sudan, its full potential is limited by many challenges. This includes political instability, armed conflict, shortages of health workers, weak infrastructure, poor financing, and fragmented services. As a result, many communities, especially in rural and conflict-affected areas, have limited to qualify basic healthcare. Our study reviewed global and local evidence. Globally, findings shows that countries with strong PHC system have better population health outcomes, fewer avoidable hospital admissions, lower health costs, and great equity in access to services. PHC improves health system by offering early detection of disease, continuous care, prevention-focused services, and better coordination between different levels of care. Sudan, the findings shows that PHC plays a critical role because it's often the only accessible healthcare level for many people. PHC centers provide maternal and child health care services, immunization, treatment of infectious diseases, and follow-up for chronic diseases such as hypertension and diabetes. This means that PHC is not only a service delivery point, but also a major pillar of system performance. However, our results also show major challenges. First, service delivery is affected by weak infrastructure. Many PHS facilities lack electricity, clean water, diagnostic tools, and essential medicine. Some facilities are understaffed, and others operate with limited hours and reduced capacities. Second, the health workforce remains unevenly distributed. Health professionals are concentrated in urban areas, while rural areas often face serious shortages of doctors, nurses, and trained staff. This weakens service quality and continuity of care. Third, finances is a major issue. PHC is cost-effective, but is often underfunded. Many people still pay out of pocket for medicine and services that creates barriers for low-income families and reduce access to care. Fourth, health information systems remain weak. In many settings, since PHC centers are the sources of many routine health data for reporting or delayed reporting effects planning. Surveillance and outbreak response. 2. Fifth, governance and leaderships are very important. Our research found that when there is strong local leadership, regular supervision, and better accountability, PHC facilities leads to service gaps, poor resource allocation, and inconsistent quality. Very important finding in our study is the ongoing conflict in Sudan. The war has severely weakened primary healthcare services. Many health facilities are non-functional, supply chains are disrupted, medical equipment and drugs are limited, and health workers are under pressure or displaced. According to the reviewed data, only a limited portion of facilities are fully operational in conflict-affected regions, and shortages of vaccines, medicines, and equipment are common. Despite these challenges, the research also identifies important opportunities. Strengthening PHC in Sudan can improve equity, resilience, and efficiency. PHC can reduce pressure on hospital, improve it can improve maternal and child health services, strengthen disease surveillance, and support progress toward universal health coverage and sustainable development goals. Our study confirms that PHC is not only a healthcare model, but also a strategic tool for health system reform. It strengthens connections between communities and healthcare system, improves preventive care, and helps system remain functional during crisis. In conclusion, our research found that strong primary healthcare is essential for health system strengthening in Sudan. However, the for PHC to achieve its full role, Sudan needs better financing, stronger workforce, stronger distribution, improved infrastructure, stronger supply of chains, digital health development, and more effective governance. Finally, we recommend increasing investments in PHC, strengthening workforce training and retention, improving medicine and vaccine supply, supporting digital health system, and increasing community participation in health planning. Thank you.